So just again, same thing for this NIHS. Now this is the 100th year. Public health. This institution developed in 2026, and this July we are planning to celebrate it. I think so. I think so. So in this centennial, I think reflection. So where should you situate the NIHS within the historical trajectory of Sri Lankan health sector evaluation? The milestones we already. So can you tell me some of the important milestones they achieved?
Yeah, the public health systems started not only in Sri Lanka but the whole of Asia. In a place called Palatata, they started this first health unit that evolved over time.
Yeah, first also.
Yes, that was this thing, and that then by that was in 1926, and by 1930s the malaria outbreak and the need for more public health people and development was needed, and then they started multiplying the health units system, which later became the NIHS system. And then in 1969 it was up to till then it was the Chief Medical Officer of Health for Kalutara. That unit became that. Also a model for other areas also. And then 1969 they converted it to an Institute of Hygiene. Right. And then 79 it was made the National Institute of Health Sciences with all that thing. So that establishment of a National Apex Training Center that was considered as a national center was one of the key factors. Then embedding the primary healthcare principles in the 70s and 78 the Alma-Ata Declaration. We already saw the primary what was told in the Alma-Ata Declaration. We were practicing that, and but it gave some more impetus, and we strengthened our primary healthcare, especially immunization, family health, and family planning. All that areas were strengthened, and the community engagement, intersectoral coordination, those were strengthened from the Alma-Ata this thing in the 78. And also the NIHS played an important role in the transition, taking in the 78 Alma-Ata Declaration into the systems. NIHS developed all the modules and training programs for all the hierarchy in the ministry, and reoriented everybody. Different 1 day, 2 day, 3 day, like that. Training different were conducted for all categories from the senior or staff to reorient. That went off quite well. And then NIHS, important factor that I see, and I'm very happy I was involved in that process. The Alma-Ata Declaration, one of the key factors they mentioned was that strengthening the national health management system, planning and management. They had a series of booklets, 6 booklets. One was on about how to strengthen the management systems. So in that they have recommended to reorient and institute from the training itself, planning and management. So we created a separate department in the ministry training unit called Health Planning and Management Teaching Unit.
This really is health planning and management teaching.
So but we didn't stop at that. We included everything, the planning and management in all the curricula, starting from the midwives. And in the PIHS, the NIHS. That from 1980s we did that. We see the results now. They are performing very well. When looking back with the PIHS, this thing that helped them. Although the technical things inputs come in, but if they were given this planning and management, they can do anything.
That's one of the examples that's in the advanced programs of this PIHS.
That's it. And how the reporting system, all that to the planning and management. And then, in fact, I advocated at that time to introduce this also to the medical schools. The Colombo Medical School gave 2 hours, and I did 2 hours of teaching in planning, and I said that's not enough.
It should be inculcated throughout.
They wrote picked it up and they had a special assessment of this thing, and they did a survey of their undergraduates from their supervisors. They assessed what are the thing, and the three areas were highlighted by the supervisor. They are weak in administration, they are weak in management, they are weak in interpersonal communication.
Definitely.
So I was asked to develop a curriculum that to develop a training program. So the undergraduate, before they take up the internship, they were given a training in this area. So we need to include in that NIHS did that we see that capabilities from they can go and work in anywhere. The PHI and the midwives, those basic principles were inbuilt in their training, and we developed curricula, and they developed manuals, and even doing projects. We have a manual for the PHIs to go and do in the community. So given that was seeing there, and then the later regulatory and enforcement competencies were developed, and then lately the modernization and emergency preparedness capacity. So those are the different landmarks. And
definitely I think so. So you have vast experience not only Sri Lanka, in other countries also. Any other countries have adapted this NIHS model, and what about their successes?
Yeah, in fact, many countries now, Bhutan is one such country. They studied, and in fact there was several workshops organized by WHO in Sri Lanka, and this thing to showcase the success. And then there was a publication also, revitalization of primary health care. In that we analyzed the success story of, they wanted Sri Lanka to be showcased in that, and how we have achieved and what we think. So that model was adopted by many other countries.
With this now, the demographic transition and also the epidemiological transition, especially with this, now we are more burdened with the non-communicable diseases, especially. So how this NIHS should recalibrate the curriculum, the training programs, philosophies, and the institutional mandate to prepare the next generation of public health professionals. Definitely we need that. We can see in the field they are more expert on maternal and child health issues or family planning or the communicable diseases. If you come for this cancer or the other non-communicable diseases, they are helpless. So how this...
It's very important that this we need to reorient the curriculum towards emerging epidemiological realities. Integrating NCD prevention and what that's happening already. NIHS has been doing that, preparing for an aging population. So we need to reorient the curricula, addressing climate sensitive health issues. Then shifting the training philosophy from disease specific to the systems oriented approaches. That we saw the importance during the COVID also, but looking at the whole system, unless the logistics come in time, although technically we do the surveillance, all that is useful. And then the evolving the institutional mandate of becoming a national hub for lifelong learning, develop more. They have set up a distant learning center also in recent times, and so
online teaching and things are there.
Centering within the other areas are the expanding the multi-sector collaboration and also strengthening research and innovation capacity. That is this thing. In fact, in the 80s, IDRC Canada gave a grant for 5 years. They set up a project, health system research project. Unfortunately, their idea was to, after 5 years, Sri Lanka to take over. But unfortunately, it didn't happen. That would have been, that was a good initiative which you would have capitalized. We need to revive that. That is very important, doing research and innovation in primary health care to sustain with the new challenges that we face.
The research is another aspect we have to look. I think definitely if you ask the public health midwife or PHIs, even IIHS, they are lacking that capacity. I think evidence-based practices are still need to be improved in the NIHS system, I think so. So, finally one question I have. So, this, the government or the governance, even the Ministry of Health or the government of Sri Lanka, the governance policies or the leaderships, would you identify the essential to safeguard NIHS in relation to autonomy or excellence?
Right.
So in future, if it should be an excellence in future settings. That's what I think. Really, I think this transformation is not happening properly. That's what I think, that with the demographic and epidemiological transition, NIHS not transformed according to that transition, I think so. So what is needed for in the governing?
Yes, to remain the cornerstone of Sri Lanka's next century of public health governance, NIHS must be led by principled visionary leaders who defend its autonomy, uphold academic rigor, and cultivate innovation. Governance must prioritize continuity, integrity, and relevance. Qualities that enable the institution not only to endure but to guide the health system through new and complex challenges. I am focusing mainly on this visionary, future-oriented leadership. We saw that sort of coming in from the beginning. I can go back to Dr. Godwin Fernando, who we developed with the institute. He has a good institutional memory, and this thing played a key role. And he was in key person, and he had that vision and everything coming from the grassroots, from the NIHS. Then came Dr. Tisakure. He was the training. Before that, he was a MOH, and that leadership was merged out and this thing. Then Dr. Yanis Sarake, and similarly he was a MOH chief.
Those who came through the bottom,
and they know this thing. So then Dr. Dulce De Silva, she was in the training, vast experience in the field, and she was in the training department. And after that, the people parachuting and the leadership was not geared to lead a premier public institution. They should have that grooming. They should be trained in education. Where are the people? We don't have people with education science experts. We need experts.
That's the thing. Yeah.
So that place must have an expert on educational science, because it's a training center, and that is lacking. And then so this leadership. When these transfer systems, 4 people come here,
annual transfers,
somebody sing, and they come and mark time and they go. Lately, I have seen that happening.
Definitely, I think so. So that is
the key thing to take forward. That's why NIHS came up. The history, the leadership is very crucial, and unless we identify people who have expertise, who have trained in that field, human resource development, educational science and technology, those two people who take up the leadership must be trained in that. Now we see people without any such qualification. Just.
So do you think the Ministry of Health will take an initiative in regard to this?
I don't know. I have been telling every time at every forum, I have been telling this. We don't have people specialized in human resource development. We have, even the ETNR unit don't have people. Those places, it's like training surgeons.
It should be a university, like I think the model should be later, I think, diverted to a university, a public health university model would be taken up. Not only they should restrict with this diploma holders and the doctors training, they have to go for the public health postgraduate training and things. That's the ideal, I think. But unfortunately, I think we couldn't make it. So these are the questions.
So these are finally the protecting the institutional autonomy. That is very important. That it's how, when it came under this thing, I saw a drop in performing. Academic rigor and evidence-driven decision making. So that we need experts trained in that this human resource development and visionary, as I said, visionary, future-oriented leadership is a must. Strong internal governance systems. Also, again, the field practice area need to be strengthened. Gradually they were giving up the curative services from the national. Even the Ramadan Hospital was under the NIHS, and deep integration with the MOH system that we have, and commitment for lifelong learning. Those are the key factors
to be. Okay, so thank you so much, sir, for your valuable time and your vision and your experiences. Definitely this will help the future public health professionals, including the grassroots level staffs and also the future leaders. Definitely these experiences, I think, will help them to make this public health system in Sri Lanka again a great scenario or field. Thank you so much, sir.
Thank you.